All right, so let's talk about designating a champion or a point person in your company for RTM. I work with a lot of companies around the country implementing RTM, either teaching them how to do it on their own or doing it for them. Um, and I can tell you that the companies that do the best have a point person, and it's usually not the owner. So an administrator, a business manager, somebody who's there to, learn and understand and track and monitor the success. So the first thing you want to think about with this point person is, the compliance monitoring. So are things being done? Are we following the rules, right? So the first thing we got to look at is, you know, whoever's doing the remote monitoring, meaning the remote provider who's accumulating those 20-minute thresholds, they need to make sure they're documenting their time, right, with details and what they reviewed. Um, Again, this is typically going to be done in the HEP software. It should allow that to be logged and tracked, but it needs to be detailed. So that's the first thing. Um, there's communication requirements that we've talked about that they need to be met. And so if you're doing remote monitoring on your own, meaning someone on your team is doing it, or you're working with a company that has remote monitors for you, really the challenge is making sure that there's not a bunch of accumulated monitoring time, 20-minute thresholds, 40, 60 minutes, which if we don't make the communication, two-way audio communication with the patient before the month's end, that's unbillable time. So really, you got to manage that. You got to understand that's an important part of managing remote providers. It's one of the hardest parts, and it's a good argument for why you might want to have a company do it for you because it is a lot to have to deal with. You don't want a bunch of unbillable time. We also need to make sure that the remote provider is communicating properly with the supervising therapist. At minimum, red flags, but there's communication. There should be happening both ways. So the supervising therapist also needs to respond to the communications, which a lot of the clinics will get our remote providers to communicate with the supervising therapist in the clinic, but they don't respond back. And so that really, there needs to be good communication, right? That's key. And then we need to have reasonable amounts of frequency, duration of monitoring. So Medicare doesn't say exactly how much to monitor. They say whatever you think your judgment is, right? And so as a therapist, to me, unless you have a super complicated patient, like 15 minutes a week is a reasonable amount of time to kind of check up a couple times on what's going on with the patient, make a phone call, communicate with the therapist on how things are going. More than that seems a bit much, but so that's kind of our average is 15 minutes a week or 60 minutes a month. But you don't want to see like 45 minutes of monitoring or in a row, like all in one session or, you know, two times a day. You want to make sure that you kind of have a framework for what you are trying to do from a monitoring standpoint. And then one of the big things I see is most HEP platforms require, let's say if we have 1,000 patients and 500 of them, qualify for remote monitoring, I'm putting all 1,000 patients in the HEP platform. And so now got to decide who gets, typically there's a turning on, like a toggle switch so that it turns on the tracking features for monitoring and like indicates this person actually is getting monitored. Most HEP platforms require that to be manually done. And so the problem with that is that, as soon as the patient is set up and educated and there's an HEP that's been created, that actually is the requirements for that first code. So technically that could turn on RTM, but a lot of times the clinical staff will not remember to turn it on, or they're not sure which insurance types allow for it to be turned on. And so a point person in your organization needs to really look at that. So for every 100 evals we get, if 50 qualified, how many got turned on? And then talking through that and making sure. So the best approach is to have an admin track it, give feedback to the clinical staff as appropriate, or better yet, have an HEP platform that does it automatically. So MovementRX does it automatically, which is pretty cool. So the therapist don't have to think about it. You can set the insurance types. The therapist just has to tag the patient, and then it turns it on or not, depending on the insurance type. But already the HEP platform or HEP is made and it's set up and educated. So you've met the rules to start going with it, but you just have to make sure that you turn on the right people. So that would be my advice for that is just making sure somebody understands that.